Greetings. Today, we will explore the question, what is the best diet for losing stubborn belly fat? Here's the thing about stubborn belly fat. It's not actually more stubborn than fat anywhere else on your body. Your genetics determine where you lose fat first and last, not your diet or exercise routine. Some people lose belly fat first, others lose it last while their face gets gaunt. The vast majority lose belly fat last. Life's unfair. Deal with it. There are actually two completely different types of belly fat, although they tend to get grouped and discussed as though they were the same thing, and they aren't. There's subcutaneous fat that is deposited and stored around the midsection, including the belly, love handles, and lower back. And there's also the deeper fat that builds up around one's internal organs. I'll do a separate video discussing the differences at greater length. In this video, we will focus on visceral fat. That said, visceral fat, the dangerous stuff around your organs that shows up as belly fat, is particularly responsive to certain dietary and lifestyle changes. So while you can't spot reduce it, you can create conditions that preferentially mobilize it. I'm the digital avatar of Dr. Max MacCloud, aka the Nutrition Ninja Doc. His passion and purpose are to solve health problems to help people achieve their health, performance, and appearance goals. He utilizes AI to save time, allowing him to spend it helping others. With over 45 years of clinical experience, he has acquired extensive specialized health-related knowledge that he wants to share, which is why he produces videos. Please note that this is not medical advice. It is for educational and entertainment purposes only. Consult your trusted progressive healthcare provider before making any significant changes in your health regimen. Now, let's get back to today's topic, but before that, I ask you to please hit the like button if you find this information helpful. Subscribing to this channel helps get this information to more people. Visceral fat is metabolically active and highly sensitive to insulin levels. High insulin leads to increased storage of belly fat cortisol. Chronic stress causes the accumulation of fat around the organs. Inflammation. Ongoing inflammation in the body promotes belly fat buildup, estrogen and testosterone balance. Hormonal imbalance leads to stubborn fat. Alcohol consumption. Drinking alcohol, especially beer, contributes to belly fat sleep deprivation. Poor sleep leads to metabolic problems and higher stress hormone levels. Processed food consumption. Refined carbohydrates and seed oils speed up belly fat gain. Notice something? Most of these have nothing to do with doing 10,000 crunches. Your six-pack abs are made in the kitchen, the bedroom, and your stress management practices, not at the gym. Here's the nuanced answer. The best diet is one that simultaneously addresses insulin sensitivity, inflammation, hormonal balance, and sustained caloric deficit. 1. Prioritize protein and healthy fats. The foundation. Aim for 0.8 to 1 g of protein per pound of body weight. Include adequate omega-3 fatty acids, wild-caught fish, grass-fed beef, flax seeds. Minimize omega-6 seed oils. They promote inflammation. Why this works? Protein preserves muscle during fat loss, increases satiety, and has the highest thermic effect. Healthy fats support hormone production and reduce inflammation, both of which are critical for mobilizing visceral fat. 2. Eliminate refined carbohydrates and sugar, the non-negotiable. Cut out white bread, pastries, sugary cereals, juice, soda, and desserts. Minimize alcohol, especially beer. Minimizing or eliminating alcohol is the biggest factor for many people. You can live an otherwise healthy lifestyle, including a good clean diet and exercise regimen, but drink your way to increase visceral belly fat despite all your efforts if you consume alcohol regularly. Be cautious with fruit juices and healthy granola. Why this works? Refined carbs and sugar spike insulin, which directly promotes visceral fat storage. You're literally feeding the problem you're trying to solve. 3. Eat predominantly whole foods. The obvious part, people. Skip vegetables, especially cruciferous, broccoli, Brussels sprouts, cauliflower, legumes, whole grains, in moderation and only if you tolerate them well, nuts and seeds, eggs, fish, poultry, grass-fed beef. Why this works? Whole foods have nutrient density, contain fiber for gut health, and don't trigger the inflammatory cascade that processed foods do. Plus, your body actually has to work to digest them. 4. Optimize meal timing and frequency, the nuance. Some people do better with intermittent fasting. Others thrive on 3 to 4 smaller meals. Stop eating 2 to 3 hours before bed. Promotes better sleep and metabolic function. Time carbohydrates around workout windows when possible. Why this works? Meal timing affects cortisol, insulin sensitivity, and sleep quality, all of which are critical for belly fat loss. There's no universal best, but consistency matters more than the specific protocol. 5. Include specific anti-inflammatory foods, the secret weapons. Turmeric, curcumin has powerful anti-inflammatory effects. Ginger fatty fish, omega-3s, berries, green tea, dark leafy greens, fermented foods, sauerkraut, kimchi, miso. Why this works? Systemic inflammation drives visceral fat accumulation. These foods actively reduce inflammatory markers and support healthy gut bacteria, which influence metabolism. Here's where most people fail spectacularly. They nail their diet, but ignore everything else. Sleep. Sleep deprivation increases cortisol and hunger hormones while reducing leptin, satiety hormone. You literally cannot lose stubborn belly fat if you're sleeping 5 to 6 hours per night. Non-negotiable, 7 to 9 hours. Stress management. Chronic stress elevates cortisol, which preferentially stores fat in the visceral compartment. Meditation, yoga, breathwork, time in nature. Pick something and actually do it consistently. Exercise strategy. Strength training builds muscle, improves insulin sensitivity. High-intensity interval training mobilizes visceral fat effectively. Steady-state cardio supports recovery and reduces stress. Most people do too much cardio and not enough strength work. Alcohol minimization. Beer is liquid bread wrapped in estrogen-promoting hops. If losing belly fat matters to you, alcohol should be minimal or eliminated. Here's where I diverge from mainstream nutrition advice. You can't out-diet a dysfunctional metabolism. If your thyroid is underperforming, your cortisol is dysregulated, your insulin sensitivity is shot, or your testosterone-estrogen balance is off, a perfect diet will only get you partial results. This is where functional medicine becomes invaluable. Getting your metabolic markers assessed and optimized creates conditions where stubborn belly fat becomes less stubborn. For most people with stubborn belly fat, this approach works exceptionally well. 40 to 45% protein, satiety, muscle preservation, high thermic effect, 30 to 35% fat, hormone production, inflammation reduction, nutrient absorption, 20 to 30% carbohydrates, primarily around workouts, from whole food sources, high fiber, 30 to 40 green daily from vegetables, legumes, seeds, minimal processed food, literally the biggest lever for most people. Consistent caloric deficit, 300 to 500 calories below maintenance. This isn't rocket science. It's just boring, consistent application of basic principles. Peptides, tesamorelin in particular, are actually FDA approved to address this issue. Red and near infrared light therapy can actually penetrate deep enough to stimulate ATP production and increase circulation that may help mobilize local fat deposits. Don't expect miracles, but it can help move the needle with this very stubborn problem. Spot reduction exercises, doing 1,000 crunches won't preferentially burn belly fat. Extreme caloric restriction tanks metabolism and increases cortisol. Eliminating all fat, necessary for hormone production. Cardio obsession. Excessive cardio increases cortisol and can paradoxically increase belly fat. Clean eating while still overeating. A caloric surplus is a caloric surplus, ignoring sleep and stress. You cannot supplement your way out of poor lifestyle habits. The best diet for losing stubborn visceral belly fat is one that maintains stable blood sugar and insulin levels, reduces systemic inflammation, supports hormonal balance, especially cortisol and sex hormones, creates a sustainable caloric deficit, not extreme restriction, prioritizes whole foods, adequate protein, and healthy fats, is paired with quality sleep, stress management, and strategic exercise, is actually sustainable, so you stick with it. There's no magic diet, but there are evidence-based approaches that work when combined with addressing the underlying metabolic and lifestyle factors driving visceral fat accumulation. The people who successfully lose stubborn belly fat aren't following some exotic protocol. They're doing the boring fundamentals consistently, eating whole foods in appropriate portions, moving their body strategically, sleeping adequately, managing stress, and optimizing their metabolic health. Ready to actually address the root causes instead of just dieting. At ARTC, the Age Reversal Technology Center in Lakewood Ranch, Sarasota, we specialize in identifying why your metabolism isn't working optimally. We assess your thyroid function, cortisol patterns, insulin sensitivity, hormone balance, and gut health, then create a truly personalized protocol that addresses these underlying dysfunctions. Combined with our elite nutrition guidance and strategic use of regenerative therapies and peptide support when appropriate, we help clients finally lose the stubborn fat that diet alone couldn't touch. Because your belly fat didn't appear overnight, and it won't disappear through willpower alone. It takes systematic, intelligent intervention targeting the actual mechanisms driving it. Visit ARTC Health or call 941-806-5511.